Hello everyone, this is Fahim Ansari, a professor in pharmaceutical sciences. Today we will discuss about the introduction of pharmacopoeia, what are the pharmacopoeias and what are the importance, and especially we discuss about the Indian pharmacopoeia. Firstly, what is the pharmacopoeia? The pharmacopoeia is derived from the Greek word pharmakon plus poia. The pharmakon means drug and poia means to make. Uh, it means how to make the drugs or medicines. It is a legal and official book issued by the recognized authorities, usually appointed by the government of each countries for their manufacturing of drugs in their area, manufacturing and selling of medicines as per standard in their country or regions. It comprises all the list of the pharmaceutical substances formulate along with their description and all the standards which are required to make for any formulations in such country. Next, what are the lists of pharmacopoeia? These are the some countries which have the pharmacopoeias like the Argentina's, Australia, Belgium, Brazilian, British pharmacopoeia, Chinese pharmacopoeia, Egyptian, European, French, German, Hungarian, and Indian pharmacopoeias. Usually, the pharmacopoeia is generally for that specific country which it is formulated. Now, what is one of the main terms which comes in the pharmacopoeia is monograph. Uh, each and every detail of a individual drug is indicated in the pharmacopoeia as a monograph. So, a monograph is a collection of detailed information on a particular drug, its dosage form, and method of analysis. The monograph contains some of the following information: first, the chemical name and chemical structure of that formulations, the formula, solubility, identification, and pH values, assay methods of the assay, and loss on dryings and dose formulations which are required for the selling of that particular tablets or substances. What are the importance of the pharmacopoeia in any country? Uh, the pharmacopoeia, it is for the maintenance of the uniformity and control the standards of the drugs available in the markets, and it avoid the adulteration of the drugs which in the markets, and provides complete information on the drugs and their the dosage formulations uh, which are sold throughout the countries or the region. And this is also serves as the laboratories for the reference book or reference for the laboratories, industries, pharmaceutical industries, academic institutions, and any other R&D facilities and F&D facilities for that countries. Now we comes to the Indian pharmacopoeia. The first Indian official pharmacopoeia of India appeared in the 1868, which was edited by Edward John Waring. It is the pre-independence days when the first pharmacopoeia is used. But this pharmacopoeia is the British pharmacopoeia also used in India as an official standard of Indian pharmacopoeia. The colonial addendum of the BP 1898 was published in 900, uh, which is appeared as the Government of India edition in 1901. Means it has an separate copy of British Pharmacopoeia which is exclusively for the India. In 1946, the Government of India issued one list known as the Indian Pharmacopoeia list of the drugs. This committee is under the chairmanship of Colonel Sir R.N. Chopra along with other 9 members which prepared the Indian Pharmacopoeia list, and it was prepared by the Department of Health, Government of India, Delhi, 1946. In 1948, Government of India appointed an Indian Pharmacopoeia Committee for exclusively preparation for the pharmacopoeia for India after the independence. The term of that committee was 5 years. The Indian Pharmacopoeia Committee under chairmanship of Dr. B.N. Ghosh, and these published the first pharmacopoeia in 1955. The standard language of the pharmacopoeia is English, and official title of monographs are in Latin form. It covers 1986 monographs. and the supplement of these editions was published in 1960 with some other additional substances or additional monographs and information. Now the second editions of Indian Pharmacopoeia was published in 1966 under the chairmanship of Dr. B. Mukherjee. This is the official titles of the monographs given in the English. Those were expressed in the metric system, and the tablets and injection usually strengths have been given. Formulation of the drugs were given immediately after the monograph of the drug. It is very precise from the first edition. Some of the new monographs, 274 monographs from IP 55 and their supplements were deleted. Some of the medicines which are in the British Pharmacopoeia also adapted in the Indian Pharmacopoeia were deleted from the second edition. And some of the new monographs are added, 93 new monographs are added, and supplement of this edition was published in 1975. Becomes the third edition of the IP. This was published in 1985 with two volumes and 9 appendices. Previous pharmacopoeias are in one volume, single volume, and it has 261 new monographs, 450 were deleted, and addendum 1 to IP published in 1989 with 46 additional monographs and 126 amendments. Addendum 2 was published in 1991 with 62 new monographs. And the fourth edition of the Indian Pharmacopoeia published in 1996 under chairmanship of Dr. Nityanand, and it is from the effective in 1st December 1996. It covered 1149 monographs and 123 appendices, 294 new monographs and 110 monographs has been deleted. Addendum supplement of this pharmacopoeia is in December 2000 and with 42 new monographs, and second addendum in second supplement on 2003, and a veterinary supplement is also added in 1996, and the fifth edition of IP was published in the 2007, and addendum means supplement of this edition also published in 2008. And this is the pharmacopoeia is published in the three volumes. Volume 1 contains general notice and general chapter, while the 2 and 3 contains the monographs and drug substances. Now the sixth edition of the pharmacopoeia is published in the 2010, and it is also in the three volumes. It was in 2010 it is published by the Indian Pharmacopoeial Commission IPC, which whose headquarters is in the Ghaziabad, with accordance with the plan and completed through the untiring efforts of its members, secretaries and laboratories over a period of about 2 years. It superduced the 2007 volume of Indian Pharmacopoeia, and some monographs are retained and some are deleted. And this is effective in September 20, and this is comes in the three volumes. Volume 1 contain the notice, prefaces, structures, and volume 2 and 3 general the monograph. The number of monographs of the excipients, anti-cancer drugs, herbal products, and anti-retroviral drugs has been increased in this edition. Monograph, the vaccines and immunosera are also upgraded in view of development of the latest technology in the field. Some of the modified deliveries or the new trends deliveries like the liposomes of amphotericin B and some other drugs is also added in this pharmacopoeia. Now, the seventh edition of Indian Pharmacopoeia was published in the 2014 and is quite very new. It is also published by the Indian Pharmacopoeial Commission. It is present in the four volume. The 2014 is four volume. Below 2014 it comes in the three, and it is also includes the anti-cancer drugs, anti-retroviral drugs, and the formulation products of biotechnologies, vaccines, and serums, and some indigenous herbs and herbal products are also added to this. This incorporates 2,550 monographs of the drug, out of which 577 are the new, and 19 radiopharmaceutical monographs are also, and one is also added in this edition. Now we comes the 8th edition, which comes in the year 2018, and it comes in the 4 volumes. It has 220 new monographs. Some of the herbal monographs are also added 15, blood products 10, vaccines and the immunosera of the human use monographs 2, radiopharmaceuticals 3 new added, biotechnology derived therapeutic products 6, veterinary monograph 14, and the some of the monographs are revised, and 53 new combination of the drugs is also added in this pharmacopoeia. Ninth edition, which is the current and the latest edition of the pharmacopoeia in India. Year it comes in the year 2022, which is also comes in the 4 volumes. It contains 90 new or the addition of 92 new monographs, and in which 60 are the chemicals, and rest 32 are the herbal or other synthetic. Some of the vitamins and supplements, health supplements are also added. 21, 3 biotechnological therapeutic products is added, and 4 human vaccines are added in the 2022 volumes. 2 blood and blood related products, 2 herbs and herbal related products, 7 phytopharmaceuticals ingredient is also introduced in this monograph. Phytopharmaceuticals are the phytoconstituents which are the obtained from the plants and used as a pharmaceutical formulation in the pharmaceutical formulations. The total number of the monographs in IP 2022 is 3152 monographs in the this current edition of Indian Pharmacopoeia. Thank you. Please subscribe our channel.